When should I put shoes on my child?
Most children begin to walk between 12 and 18 months of age. For babies learning to walk, bare feet are often the best. This allows them to feel and learn from their environment about different surfaces and textures that they come in contact with. During these early days of walking, soft-soled, non-slip booties and socks are the best way to keep their feet warm in cold weather and to offer their feet protection if walking or crawling across rough surfaces. Allow 2 to 3 months after their first wobbly steps before rushing off to buy them their first pair of hard-soled shoes.
So what should I look for when buying hard-soled shoes?
It's very helpful to take your child to an experienced shoe fitter. They will help establish the correct length and width of the child's shoes. There are 4 important points to look for in a shoe. The sole of the shoes should be firm but lightweight and flexible across the toe joints. Avoid shoes which bend in the arch or bend so much that the heels and toes can touch together. The shoes should also be fairly stiff in the sole when twisted long ways. The shoes need to have a firm heel cup that cradles the heel of the child. This means the shoe or the sandal should have a solid back in it, and if squeezed together, should not easily flatten. This will give the shoes good stability. Buckles or laces provide more support than Velcro or elastic, especially for children with very narrow feet. Buckles and laces allow for securely fastening the shoes onto the feet and stop the heels from slipping and those little toes from clawing. The shoes you purchase need to be straight-lasted. In order to find this out, look at the shape of the sole of the shoe. Turning the shoe over, put an imaginary line up the middle of the heel and project that line to the toe area. In a straight-lasted shoe, you will note that the shoe is divided symmetrically, and this suits the natural, slightly triangular shape of a normal foot. In a curve-lasted shoe, however, you will notice that when you put that line through the heel, it does not bisect the shoe equally, and instead there is a curve towards the big toe side of the shoe. This is not an ideal shaped shoe for a growing infant's foot. The front part of the shoes should always be wider than the heel and match that natural triangular shape of an infant's foot.
How often will I need to buy shoes?
Children's feet grow reasonably quickly. You will find that you need to have their feet rechecked and possible new shoes every 6 months, up until about the age of 6 years. At this point, you may then get a little longer out of each pair of shoes. Young children grow out of their shoes rather than wearing their shoes out. Because of this, 1 pair of stable, supportive shoes at a time is all that is necessary in those very early years. When buying the new shoes, it is recommended to have at least 12 to 14 millimetres of growing room from the end of the longest toe to the end of the shoe. This should give your child 6 months growing room before another pair of shoes will be needed.
What are other tips I should keep in mind?
Always have both feet measured for length and width. Avoid slip-on shoes because shoes should be held onto the feet by laces, straps or Velcro if the other 2 options are not available. Have low heels for children. The heel and the sole should have a broad base and be made from shock-absorbing material, and natural materials are best for the uppers. The toe area of the shoes should be foot-shaped and roomy enough to allow the toes to move freely and not be squashed. And the shoes should fit well around the heels to minimise foot slippage.
When should I see a podiatrist?
A checkup with a podiatrist is recommended if you notice uneven shoe wear, you notice any skin rashes, hard skin, lumps or bumps on your child's feet, your child complains of recurrent pain in their feet or legs, your child is constantly tripping or falling, or you have any other concerns about your child's feet.